My name is Sara Clifford, and this summer I interned with the Wisconsin Department of Health Services, located in the heart of downtown Madison. I interned with the Bureau of Community Health Promotion. One of the first things I learned was just how confusing the state public health department hierarchy can be. Within the Bureau, I was nested in the Chronic Disease Prevention Unit, and within that, the Wisconsin Coverdell Stroke Program. This program aims to demonstrate improvement across stroke systems of care, from EMS response to inpatient care, secondary prevention, and post-stroke rehabilitation. Jess, my mentor, is the program director. She works alongside EMS and hospital partners across the state to monitor patient success across the care continuum. I started off my summer preparing for our CDC site visit. The Coverdell Stroke Program is funded through a competitive national grant supplied by the CDC. Therefore, they came to visit and see all that our program does. I created attendance surveys for the event, sat in on conference calls about data presentation, and created all-inclusive informational binders for each of our attendees. The two-day visit was as informational for the CDC as it was for me. I learned a lot about not only how the Wisconsin Coverdell Stroke Program functions, but also how federal funding operates. I loved getting to meet representatives from CDC as well, because this is an entity that I'd be interested in working for one day. Another project I spent a lot of time on was creating a stroke patient success story. It's important for EMS and hospitals across the state to recognize the success of others, and this story was a perfect example. I got to interview both the stroke and EMS coordinators who responded to this particular stroke call. The finished story demonstrated how teamwork and education can create successful patient outcomes. I was excited to exercise my communication skills not only with the success story I created, but also with the community outreach toolkit I worked on. Since time is critical when responding to a stroke, it's extremely important that the public is well educated on how to recognize the signs and symptoms. Aside from these larger projects, I also got to attend many events, meetings, and conferences that gave me a deeper understanding on state government partnerships. Additionally, my mentor made special efforts to connect me with as many people at DHS as she could. I not only got to meet everyone in the Chronic Disease Prevention Unit, but I also met many folks who work in infectious disease, an area of significant interest to me. It was an amazing opportunity to hear about people's roles at DHS, and I got connected to more public health professionals than I could have imagined. Overall, my experience in the Department of Health Services with the AHEC program has been incredibly beneficial to me as a future public health professional. I've gained knowledge and skills that I'll carry with me as I enter my MPH program in the fall and beyond.